Right here on KOKI, Fox 23 Tulsa.
Welcome back to Daybreak. Good Morning America host Robin Roberts has been dealing with MDS, a blood and bone marrow disease, and has brought the disease into the limelight. Joining us this morning, our friend Dr. Jag from the Cancer Treatment Centers of America on some ways that stem cells and bone marrow transplants can be used to treat blood cancers. Thanks so much for being with us.
Thank you.
Talk a little bit about the prevalence of this. How often does this type of thing come up in folks?
It's not often, but it is present and it requires treatment. So the cancers of the blood is a liquid cancer. When you think of blood, we think of it as a fluid and not necessarily an organ, but it really is an organ. So we have solid tumors, which are cancers of the lungs, colon, prostate, breast, and so forth. But the blood itself is made up of multiple cell lines and multiple elements, which can transform and become cancerous. So that's where we see leukemia and lymphoma as being considered as liquid cancers, or cancer of the blood and bone marrow.
And talk about the challenges of treating something that is so different than every other kind of cancer that is treated. When obviously you're dealing with liquids, it's a much different story.
It is a much different story because you can't really measure them on a scan. You can't really measure them with tumor markers or anything like that. So most of these things are measured by blood tests which look at the cells themselves. Do you have leukemic cells present on the bone marrow, itself, or in the peripheral smear of the blood?
And you've actually brought some examples along to show us how stem cells work in terms of the treatment.
Right. So our newest facility at Cancer Treatment Centers of America is the bone marrow transplant program here in Tulsa, and it's the second one in Tulsa. So we have elements here that are making up the bone marrow, and I borrowed these from my kids again to describe the elements that we would see. So these are stem cells. These are the cells that have the ability to become every different cell within your body. They become megakaryocytes, which produce platelets, become red cells, which transport our oxygen, and then they can become white cells. Now, what you don't want to have happen is this guy. This is a hairy cell, and it's a leukemic cell. So this hairy cell leukemia is something that you don't want to have happen, which can happen when your white cells transform into a cancerous type of cell. So the idea is that you wipe out the bone marrow with all these cells, and then you reintroduce the stem cells back into your bloodstream, which then becomes all these different cell lines. They repopulate your bone marrow so that you can produce normal elements without having the leukemic cells present.
And can you completely eliminate cancer from the blood?
You can in certain situations. Most patients can achieve a complete remission or a CR, and then we monitor them over time. Now, this isn't applicable to everyone because it depends on the mutations that are present within the bone marrow itself. But for most patients with hairy cell leukemia or different types of leukemias, such as AML or ALL, they can be cured.
Very interesting stuff. A lot of hope out there for a lot of folks. Thank you so much. This is something that definitely kind of opens our eyes a little bit to different kinds of cancer, and blood cancer, definitely one of those that's been in the news a lot lately. Cancer Treatment Centers of America has a special offer for Fox 23 viewers, a free subscription to the quarterly magazine Cancer Fighters Thrive. Just head over to fox23.com, click on the Fox box, and search Cancer Fighters Thrive to sign up. Cancer Treatment Centers of America has a special offer again for Fox 23 viewers. All you have to do is head to fox23.com, click on the Fox box, and search Cancer Treatment Centers of America.